Just to have a little look at what's around the corner, I think, from our perspective, and perhaps tying it back into some of the comments and points put forward by Sue, because I think what we realise now is that having sort of prodded the sleeping beast, we've now got some pretty big things being pointed at us that actually are probably going to stretch us a bit. And so we've got to think about how we're going to respond to that. Within the organisation, there's a project around, I mentioned at the very beginning, around replacing all of the beds and trolleys across quite a large organisation. And so we've been asked to be involved in actually looking at the specification of some of those trolleys or beds and devices, and thinking about doing some testing around how they are used not just by many different members of staff, but also increasingly as complex bits of kit, how patients will interact with them in terms of being able to get in and out, being able to manoeuvre them, position themselves. Many other facets of beds now, it's a bit like the remote control on the television at home. I'm not allowed to use that, but it seems to have quite a lot of things on it, and I probably only press 3 buttons. But actually, how do we inform the organisation about actually an appropriate specification for equipment like that of such scale that will be used in so many different contexts across such a diverse group of patient population? So that's quite a big piece of work which is just waiting in the wings to get going. We've recently advised around specification and testing of defibrillators, which are due to be renewed across the organisation, and we've managed to help at least put some human factors thinking into how that decision is informed from the resuscitation team about types of device that we might be looking for. A bit more worryingly, we've also been asked to get involved with the electronic prescribing and medicines administration project, which is due to come. That seems like quite a big project to me, and potentially some quite serious implications. And that's in an organisation where we've sort of lived with some major technological changes in the past few years, which have proved to be quite challenging. And so it's great to have been asked to advise, at least at an assurance level, early on in that project, in this project, before we perhaps fall down some traps that might be out there for us. And I think the ability to look at it objectively using a human factors lens, to think about other organisations that have already implemented projects like this and understand what that is like from the user's perspective, I think a really valuable opportunity for us. And then just last week I was asked, oh, by the way, we're redesigning the whole of the acute and emergency care pathway, including all of the ground floor around the emergency department. Would you like to get involved? I said, oh, yes. So there's a part of that we will get involved with and advise around design of environment, in particular around the resuscitation area. But I think it's really rewarding. I think to think that actually now some of the concepts and the potential value of having a human factors approach in some of these major projects is being perceived as offering some value. I think we've yet to really think hard about realising what that value might look like in healthcare, and I think there's a real opportunity for us to do some of that work both locally and across the region and at a national level with some of these projects, and I think we should be thinking quite ambitiously like that. Because the other thing that seems to be happening is that the health service is being reorganised, apparently, and integrated care systems, etc., etc. So it's much wider system changes are going on out with our site within an organisation, for those of us who work on the front line maybe, but actually some of these will have fundamentally important impact on performance of how we organise work, how we develop a workforce to meet the needs of our patients and families and so forth in these environments. So to actually have an opportunity to offer a human factors perspective in some of that work, I think we hope will be requested, will be offered, and will be valued. And so I think some of these ideas, this thinking is now coming to fruition, and actually it's finding the ways of actually who are the right people to do that. How do we develop that capacity, that capability amongst ourselves? And how do we know when we're reaching our limits and we need more expert input, and how do we find that? And I think that comes back to some of Sue's points a bit earlier. What have we been doing? I guess if I've been thinking back along our story, I think we've been developing from a lens which has looked at education and training to look at team development, to engage teams in becoming more aware of the systems around them and how that is influencing the way in which they work, their performance, how that might vary on any given day, how that might be influenced by wider system changes in their service or the organisation, how they can be more informed and perhaps contribute to informing some of those changes at an earlier stage. We've been driving that through involvement with projects, because actually getting staff involved in projects that involve change in their area is actually quite a useful way of opening their eyes, and they're very willing. I think we're all very willing to get involved with some of those. We've been frustrated by not being involved with some in the past, so that's quite a good driver. I think we're seeing the need to collaborate and work more smartly internally within the organisation between us with a human factors perspective and colleagues that are more driven through quality improvement, those colleagues within organisational development, other facets of actually how the organisation develops its staff, looks at how to improve its systems, organise its work. And actually that's where the real collaboration needs to take place. We need to be really smart at actually capturing this opportunity to do that, and actually just check our language and make sure that we're actually talking about the same things in the same way, and actually understanding then where some of these wider networks around us, where we can lean on them, pull that expert support in. We've been fortunate to be pretty well connected here, and especially in the East Midlands with Loughborough, having the Chartered Institute is based in Loughborough, as well as the university having its own master's programme, similarly with Nottingham, similarly with some other institutions around us. I think we're pretty well placed actually in the Midlands to make something of this if we wish to set out that ambition. We run education and training up to a master's level in quality and patient safety improvement. Other master's programmes are available. So thank you. I couldn't find a picture of the Loughborough one. Well, I don't know. It's just weird, isn't it? Yeah. No, but actually, these programmes are available, and as Sue was mentioning, I think people from a healthcare context are now accessing them and seeing that actually, if that is the way that your career is developing, that's of real value. And we hope that will continue, and we're certainly looking at our relationship with the Chartered Institute and saying, well, actually, let's develop that body of expertise locally, let's build up that capability locally. We're being in a very fortunate position that from the new year we have appointed 2 human factors practitioners to be working with us in this organisation, initially on a fixed term, but actually that I think is really going to help us develop some of this work in more depth and to strengthen the relationships that we could have internally and externally to sort of continue some of this work more thoroughly and more robustly, and perhaps with greater capacity than we've managed so far. And I think I really look forward to what the next year looks like with those 2 colleagues joining us. That sort of brings us to the end of the presentation, really, and thank you for your concentration and staying with it.